it's a common, misconception that everyone gets the Hollywood smile when they get veneers or crowns or cosmetic crowns. And, to be honest, I think that there's some level of tastefulness with how white your teeth get. If your teeth are too white and they look like toilet bowls that are all, stuck to the front of your mouth, it doesn't look great, right? I mean, we don't want to do that. I always say if you're going to pick a whiter shade, pick a shade of white that is natural that you can age into. You don't ever want to pick something that doesn't make any sense. Because guess what? If you pick that toilet bowl white, when you're 7 years old, everyone's going to know that guy's got veneers. And so I always tell my patients be natural. Choose something that is normal, but is going to make you confident with your smile. When we do a smile design, I always tell my patients, hey, we're gonna be able to edit this, one or two times so that you can decide how you want to do it. And the reason we do that smile design in the, before we even touch your teeth is because we want you to know like what you're gonna get. We want you to have an idea of what the product you're gonna get, what your teeth are gonna look like, what your teeth, what your smile is gonna look like. Because, if we're bringing your teeth inwards more, right? Because sometimes we have to, then maybe your lips are going to seem a little more sunken in, right? Or if we have to put them a little more out, your lips might seem a little more full. So, it's a matter of deciding, what your goals are in terms of your teeth and stuff like that. I like to go for that more like neutral look where we're not changing too much so that, your teeth look really great, but we're not maybe changing your whole facial appearance necessarily because most of the time we don't want that. That's not really what you want to do. You don't want to look sunken in. You don't want your lips to be like this. You want to look natural. You want to have a nice smile, and that would be our goal, from the get-go. When I do a smile transformation for a patient or a full cosmetic case for them, the first emotion that most people have, honestly, is like speechlessness. I think that a lot of them are people that have just been, not happy to smile or kind of embarrassed of their teeth. And, for most of them, they're just like speechless. They just don't know what to say, right? And, it's not uncommon to see tears either, where people will tear up because they love how their teeth look. So that's not off the table. I've even had people that don't have any emotion at all, and it's a little weird to me, 'cause, when their teeth look so fantastic and they have no emotion at all. But you know what? It's like we all express ourselves differently, and so if that's the way that you want to express how you feel about your smile, then great. And if you want to cry, great. If you well, not great, but you know what I mean. But yeah, we see a whole range of emotions. Probably speechlessness is like the top one that we see when we see a smile transformation. We often talk about doing a full smile design and cosmetic makeover for a patient. And when we talk about that, we usually talk about upgrading your smile or upgrading your teeth. And the reason why we word it that way is because we want you to know that like everyone's teeth is great. I think everyone's teeth, they have their own shapes and their own characteristics and all that kind of stuff. But like ultimately at the end of the day, you're wanting to upgrade those teeth to something that maybe is a little more aesthetic, a little bit wider, a little bit more uniform, and just something that's going to look really beautiful so that you can confidently smile. And so what we say upgrade, and we say that because we really think that we're going to upgrade your life and we're going to make you so much happier once your teeth are in a better space. Durability is always that topic that comes up with cosmetic dentistry. Whether that's veneers or cosmetic crowns, whatever it might be, doing cosmetics is not easy. And, especially for people that maybe are grinding and clenching their teeth, which a lot of people do, veneers are maybe not always the best option for you or other people, right? And so, for those types of people, what we'll do is we'll actually tell you like, hey, maybe we should do cosmetic crowns instead of cosmetic veneers to maybe avoid these future problems down the road. And then what I also say is like, unfortunately, when you cross that bridge, we really shouldn't be, eating specific things. We shouldn't be, eating corn on the cob like a madman with your expensive veneers. Um, we really should be kind of safeguarding, your investment in yourself, right? And so I'll give you the tools to do what you need to safeguard your investment. And, I'll even give you a free night guard if that's what it takes. But like, really, I need you to, listen to what I have to say, listen to the instructions, and chances are those teeth are going to last a long time. The beauty of modern technology is I think that we've just perfected the bonding protocol, right? And so, we are able to, bond, the correct way, and those veneers or those crowns aren't going to come off nearly as easily. Now, that being said, we're also, because we have technology and everything is digitalized, now we can even see what your bite is going to do before we even touch your teeth. And so the beauty of that is that, we can see any of the malocclusion that you're going to have, or any sort of, forces on the teeth that maybe are not so favorable for those specific, that specific work that we're doing. And we're going to account for that before we even go into it. And so, everything's accounted for, everything's thought of before we touch your teeth. So when you get your teeth worked on, it's going to be a much more predictable result.